Ladies and gentlemen, welcome to today's webinar titled The Ins and Outs of Injection and Infusion Coding. This webinar will be presented by industry expert Lynn M. and Renan. Lynn, welcome to the webinar. We are now ready to begin.
Thank you so much. Hi, everybody. Welcome to today's webinar. Today, we want to talk about the complicated coding of injections and infusions. This is our agenda for today. We want to take a look at the very specific CPT guidelines that are available for us related to injections and infusions. Then we also want to look at the different kinds of injection and infusion codes there are. We want to look at the NCCI policy manual. This is part of the NCCI edits, and we'll talk a little bit about what the policy manual is if you're not familiar with that and where you can find that. We also want to talk about the assigning and reporting of drugs. Then I just want to focus a few minutes on the ICD-10 diagnosis coding related to injections and infusions. There are some special guidelines in the official guidelines of ICD-10. So the first thing, now, just so you're aware, these are in the area of the CPT manual where the injection and infusion codes are. So the first thing we look at is the items that are included and not separately billable when we are talking about infusions. The basic concept in billing for these codes is what is the initial or primary procedure for that day, hierarchy of what is important. There is a hierarchy that they want you to use. All right, so now we want to talk about these add-on codes and how we use them, because there are different kinds of add-on codes. Now we have another add-on code that's called sequential infusion. And this is when we've given a patient a medication for a period of time, and now we're giving them a new or different substance or drug after the initial service. We have concurrent infusion. Now, this is when two drugs or more are given at the same time. So we have four categories of codes that we want to take a look at. The first being hydration. And then as we go through the other additional codes, there is the group of codes that is called therapeutic, prophylactic, and diagnostic infusions and injections, maintenance for the pumps or access devices, and then we have the chemotherapy codes. So the first thing we have is hydration. The next group of codes does a lot of different things. We could be doing them therapeutic, prophylactic, or diagnostic. Some other codes we have for the therapeutic, prophylactic, and diagnostic are, now let's take a look a little bit closer at the push technique. A healthcare professional that is continuously present and administers the injection and observes the patient. Now let's talk a little bit about chemotherapy. We also have the intravenous push codes for chemotherapy. The chemotherapy codes are also used for biological agents or complex drugs. The intra-arterial chemotherapy codes. All right, some of the other services when it comes to chemotherapy, the codes that are related to the maintenance of pumps and venous access devices. All right, here is a slide that I hope will be helpful for you. All right, the NCCI edits. All right, we want to now take a look at some of the things that are in the NCCI policy manual related to infusions and injections. Again, hydration that is concurrent. Now, related to chemotherapy administration, so our drugs that we use are found in the HCPCS manual. This is managed by CMS and Medicare. Now, when we're talking about drugs, one of the things that many of the insurance companies require us to do is to submit the national drug code. All of the drugs do have a national drug code. There are different methods of drug reimbursement that could be utilized. Most of our drugs are going to be covered under the ASP. These are the different methods of drug reimbursement. Also, when it comes to the chemotherapy drugs, from a Medicare perspective, there are currently 5 acceptable compendiums: the discarded drugs, and what needs to be done when in fact you are utilizing a single use vial and you're not utilizing all of the drug. All right, one last thing we want to take a look at is diagnosis coding when we're talking about malignant neoplasms and cancers. So when we look at anemia due to chemotherapy, we're going to code the anemia first and then the neoplasm code, followed by the poisoning code. Another guideline in those guidelines for ICD-10 tell us that when a patient is coming in and the purpose for their visit or admission is for chemotherapy, we should be assigning the Z51.11 category of codes for encounter for anti-neoplastic chemotherapy, then followed by the malignancy as a secondary diagnosis. The last thing that we want to mention is the long-term therapy for breast or prostate malignancies. All right, that's all I have as far as the presentation for today. I hope that I have helped you, and I hope that I've given you some good information and examples of things that you may be seeing in your office. I want to thank everyone for joining us today, and hope to be talking to you in another seminar on another topic real soon. Have a great day, everyone.
Thank you, Lynn, for this amazing webinar. Ladies and gentlemen, this is the conclusion of today's webinar, the ins and outs of injection and infusion coding. To disconnect, you can simply hang up. Thank you.